welcome to our SIA-IPhO channel. My name is Elham. We have a special guest today, Dr. Kenneth Liu. Thank you for joining us. Dr. Liu is Regional Account Director, U.S. Market Access at Sanofi. He graduated from PharmD program at Rutgers University, and he had his post-PharmD fellowship in U.S. Medical Managed Care. Dr. Liu, thank you for being here with us today. I wanted to give you a chance to introduce yourself and a little about your background and your journey into the pharmacy profession.
Sure. Thanks for the introduction, and nice to speak to all of you, I guess, virtually, eventually through this recording. As Ella mentioned, I'm a pharmacist by training. I went to Rutgers University for my PharmD. Shortly after Rutgers, I found myself in at the time, it was the Genzyme, a Sanofi company, U.S. Medical Managed Care and U.S. Medical Affairs Fellowship. Did that for 2 years, moved on to a market access function we'll talk about a little bit shortly after this, at Bayer for about a year, and then did a few things around payer marketing at Genentech in San Francisco. So I moved out to San Francisco, and I currently live in Los Angeles, and I'm currently back employed with Sanofi, no longer Genzyme, a Sanofi company, but Sanofi Specialty Care. So look forward to the conversation, Ellen.
Thank you so much. Thank you for sharing your journey with us. So why market access?
Yeah. I want to first define maybe what market access is. So market access is it's the patient journey from after a medication is prescribed by a physician to when the medication is administered to a patient. So there are a lot of things that have to happen in that period of time, right? So we have to ensure health plan coverage and reimbursement for the medication through a pharmacy benefits manager, through the health plan of the patient, through the employer, right? That patient, if they have commercial insurance, therefore their employer provides their insurance. To make sure that all folks along that chain are kind of clinically educated on the financial and clinical value proposition for the medication. Distribution, how that drug gets distributed from the manufacturer and all the way to a patient, right? And there are a couple different characters along the way there, including wholesalers or distributors, your AmerisourceBergens, your Cardinals, your McKessons, as well as the pharmacy, right? So if it's a specialty product, which specialty pharmacy will be dispensing it is may be mandated by the patient's payer, et cetera. And if it's a retail product, which retail pharmacy would have it in stock, would dispense it for the patient in a way that's convenient, right? With the appropriate amount of counseling. We have to address patient out-of-pocket barriers, right? If the insurance determines a co-payment or a co-insurance that the patient has to pay, is it one that the patient can afford on a monthly basis for their refills? And do they need additional support in the form of a copay card or some other financial assistance to make sure that that patient is adherent on that medication as prescribed as possible? So in general, why market access? If you enjoy the business of the healthcare delivery system within the United States, it's the most complicated healthcare system in the world. Then the area of market access is one in which you would engage with all of these types of managed care entities and more to ensure appropriate access to medications. So that's kind of why market access in the industry in a nutshell.
Thank you for sharing the information with us. So as a director of the market access, can you tell us about your day-to-day daily activity? What do you do during the day, and what do you like the most about your job?
Yeah, absolutely. So I am a regional account director at Sanofi Specialty Care. My job is to meet with various members of that healthcare delivery system. So whether it be payers, health plans, PBMs, specialty pharmacies, in California, capitated medical groups, and I educate those regional payers, health plans, medical groups, IDNs, or hospital systems, et cetera. My job is to educate them again on the financial and clinical value proposition for our product portfolio. We've got I think something like 15 or more products in Sanofi Specialty Care, and so educating them about cost, about cost effectiveness, about the clinical value for the products, and therefore justifying appropriate access for patients that these managed care entities may have risk for. So what that means from a day-to-day perspective is a lot of customer meetings with those customers, and meeting them either in their office or at a conference or various other places over Zoom more often than not these days, virtually. It also means liaising with sort of internal people within Sanofi Specialty Care. So I'm part of what you would consider a field team. So I don't go into the home office or the headquarters of Sanofi every day. That's located in Boston. I come in there maybe once a year, but much more frequently than that, I'm talking with people in our marketing groups. I'm also working with the sales teams that are out here in California in my territory, and basically educating them on the managed care landscape, on formulary status for our products and where they sit. I liaise also a lot with, I have a medical counterpart, and so we kind of collaborate when we meet with customers. My medical counterpart is much more scientifically focused. They're the ones that can speak off-label compliantly. They can speak to in much more detail around real-world evidence and health economics. And my job is to kind of quarterback that engagement, and occasionally also bring in leaders within my organization to meet with my customers where appropriate. So that's kind of my day-to-day.
Awesome, thank you. So can you tell us about your fellowship program? How did you go about choosing the right program for you?
Yeah, so it's a bit of a long story that may bleed over into like a couple of the other questions you have prepared, but I'll just do it anyways. When I applied for fellowships coming out of school, the fellowships, I did not have a good understanding of the pharmaceutical industry, which is why I'm glad that there are students within USC and members of IPHO that hopefully are educating themselves prior to that process. So the only job I was somewhat familiar with during my time as a student was the medical science liaison position. I was not that involved with the pharmaceutical industry during my time as a student. So when I applied for fellowships, I really just kind of applied for that one job I knew about or had heard of basically during my time on rotations, of which none were into the industry either. And that was the MSL fellowships. And there were a couple at the time, and I think there are probably more now. And it just so happened that the one at Genzyme, a Sanofi company at the time, there was one with a specific focus on multiple sclerosis. And I happened to be lucky enough to have presented on multiple sclerosis during my rotation, one of my rotations at CVS Specialty Pharmacy. And so I had built up a decent bit of knowledge in the space. And I think that interviewing panel really appreciated my knowledge in multiple sclerosis. I think perhaps that helped me stand out a bit, if you will. The medical science liaison position is very focused on scientific expertise, right? So more so than anything else, I think that was important to them, that I was therapeutically up to par, if you will. And so it just worked out basically that I looked at residencies and fellowships at the same time while at mid-year. And so that process just moved faster, and I ultimately went down that path as a fellow. It was in my second year as a fellow, or during my time as a fellow, I started kind of discovering different other business units and functions within Sanofi and Genzyme, and ultimately discovered a passion for managed care and interacting with managed care entities during the fellowship. So the whole second half of my fellowship was focused in medical managed care, where you're not really the medical science liaison, meeting with doctors, but rather an MSL that meets with payers and health plans and PBMs. And so I did a lot of I helped with customer presentations and all sorts of other projects there. And yeah, so that's kind of how I found myself in that particular fellowship.
Okay, perfect. So what are your thoughts on fellowship versus a direct to industry job? For example, consulting as a career path.
Yeah, so consulting is a very broad word. First of all, I want to mention that, and it really depends on what specifically the path of consulting you choose to take. First, let me start with fellowships. Maybe I think they allow for tremendous growth opportunities. Fellowships have a lot of built-in opportunities to get exposed to many different parts of the industry, right? And I think as a student, you don't really have that opportunity sometimes unless you have a rotation or an internship or something. When you're in a fellowship and you're not 100% sure what area of the pharmaceutical industry you want to work in, the fellowship just there's a large alumni, right, and preceptor network. Your current co-fellows, depending on how large your fellowship program is, you may have many co-fellows with different parts of the business, and you can learn about the things that those folks do every day, et cetera. And that hopefully will make you make a more informed and fulfilling career decision. If you have selected a good fellowship program, there's also a good chance they'll retain you, right? So the retainment within fellowship programs can vary, but a good one will make sure to keep you on. But you kind of referenced it's not the only path into the industry, and that's very true. You can move into the industry as a student or as a clinical pharmacist, maybe several years after being a student. And the areas most commonly of pharmacovigilance or drug safety, which is really about adverse event reporting in the field. When a patient takes a drug, is an adverse event properly reported internally? The pharmacovigilance and drug safety team will often do like a statistical analysis to determine if that adverse effect is actually associated with their medication that the patient took. And if so, they would update the prescribing information for that medication to reflect that based off of statistics, right? Or prior to the drug being approved during the clinical trial segment, typically the drug safety team is pretty involved with monitoring for adverse events amongst patients in the clinical trials. And that's a common area for pharmacists to kind of walk into without a fellowship if they're from other parts of the pharmacy world. Another area is medical information. So the job of medical information is to complete and maintain a database of standard response letters, we call them, right? So if a patient, a physician, anybody out there in the public has a question about a drug related to temperature control or this particular data or what have you, right? And they can submit a question into the hotline, like the telephone line or via email to the medical information department. And they will typically send a letter, a response, basically, with the information requested. So part of the medical information team's job is to maintain that list of standard response documents and also deliver them where appropriate to members of the public that may have questions medically about a drug. So 2 areas where you can kind of roll in. And that's not necessarily without a fellowship. It's a little easier to get into those. You mentioned consulting. So consulting is a very, very broad term, right? So first there's contractors, right? Those are people that are on a 1, 2, maybe 3-year contract. And actually fellowships are technically contracts. They're just contracts with a strong program design around them, right? But you could join a pharmaceutical company within drug safety or medical information as a contractor for a year or 2. They would pay you at a full salary. They would not provide you with healthcare benefits. They would pay you money so that you would seek your own healthcare benefits, basically. And you would choose, or the company would choose to re-up that contract or transition you to a full-time employee. And that's what really a fellowship is, again, just without, the fellowship has much more structure. You're going to get paid significantly less in years 1 and 2 during the fellowship program, right? but that's what a contractor is. Now there's consulting. If you think about a pharmaceutical company, they have a million different things they send off to different vendors, right, or consulting groups, right? So a marketing agency, right, will work with the marketing teams employed by the pharmaceutical company to create the advertisements, the marketing pieces, the marketing message, right? You as a pharmacist could seek a position at the marketing agency that works directly with the manufacturer, right? There are very fulfilling careers as an account supervisor or what have you, where your customer is Merck or Pfizer or whomever, and your job is to keep them happy and help them creatively design the message around a product. There's consulting, even those areas I mentioned in medical affairs and drug safety, they often hire consultants to help them either with the statistical analyses or to develop dossiers or things like that. And those consultants, and you can join one of those consulting agencies that pharma would hire to complete those projects, basically. There's another path of consulting called management consulting, right? So you have business school graduates that typically move into the management consulting route of McKinsey or Boston Consulting Group or what have you, right? Other similar places. And those consultants do all sorts of things, right? They do some market development work, market research on behalf of the pharma company. They'll look at business development opportunities in terms of mergers and acquisitions, they'll so on and so forth. I have to say that there's a very small percentage of pharmacists or pharmacy students that move directly into a major kind of management consulting group. But it is a path that some have gone down, right? And can often be lucrative and fulfilling. Advice, be visible, be active, and be seen, and develop experiences within your education that would lend themselves well to an interview, right? So if you can support your professor, right? If you have a good relationship with your professor and they do a bit of research, if you have an opportunity to support them in that research by doing a poster, right? Or some other publication during rotations or even before rotations. If you're proactive, you can also seek, there are internships within various manufacturers that you could seek and apply to and hopefully be selected. And those would be great experiences to leverage when you speak to, when you go through the fellowship process at ASHP mid-year. Rotations, if there are opportunities through your school to seek rotations that might be relevant for the pharmaceutical industry, of course, at the pharma companies themselves. Secondary to that, some consulting groups and some of those agencies I mentioned before do take students on rotation. In addition, things like there's an FDA rotation, or many FDA rotations actually, that you can apply into. And those would be directly applicable as well to if you're interested in regulatory affairs within a manufacturer. So kind of just creating this list of experiences before the interview process would be super supportive. And then getting comfortable with understanding, obviously, ASHP mid-year, and then all of the available fellowship. And I'm sure IPHO, I think they have like a database of all the physicians and a little bit about them, et cetera. But getting yourself familiar with the landscape and having a basic understanding of the departments, right, their functions and what they do, which is why I think I'm on this call today, will help.
Nice, thank you. Thank you for sharing your insight with us. And at the last question, what is one piece of advice that you would give to P1 students who just started pharmacy school?
Yeah, it's interesting because by giving all of this advice, it's some of the things I did wrong, perhaps, right, when I was a student, right? So when I was at Rutgers University, I had none of those things I mentioned before. I simply just, I don't know, I walked in probably the hard way, right? But those are the things I reflect back on and may have set me up for success even more so if I had engaged in internships or sought industry rotations or things like that. If you're an early P1 student moving into the moving into this, into your later years, I would recommend, one of the things that I'm glad I did, which is I started to say yes to anything I could, right? There's this movie with Jim Carrey, it's called Yes Man, right? It's a great comedy, first and foremost. But second of all, there's a philosophy there where he physically can't say no to somebody when they ask him something, right? Or when there's an opportunity that presents itself. And I think that that is so, like, I just think of all the things that had to have happened that I said yes to just because, just to get involved. And it doesn't have to be manufacturer related, it can be anything. And the reason I say that is because I wasn't even going to go to ASHP mid-year to conduct or to perform or to do fellowship interviews or residency showcase networking, because the only reason I ended up there was because I said yes, because a buddy reached out. He said, hey, there's this ASHP clinical skills competition, right? It's at Rutgers, and we're performing against other teams. Let's just enter this competition and see what happens. And I said yes. And we happened to end up going to mid-year to compete at the national level because of that, because the school helped pay a little bit of our travel to mid-year. And we both said, hey, as long as we're there, let's just look at other stuff. I was a 6-year CVS pharmacist in school. I interned at CVS, and that was it. I went to mid-year and I talked to residencies at the showcase, and I interviewed for a few fellowship programs, and that probably changed my life, right? So just by saying yes to anything, right? I was involved with the NCPA, the National Community Pharmacists Association. That got me introduced to a couple folks that also ended up helping shape my career path. Just getting involved, and it doesn't have to be manufacturer related.
Thank you. Great advice. Thank you so much. I think this would be a valuable source of information for PharmD students. Dr. Liu, thank you for your time and your great advice. Have a great day.
Happy to help.